Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today we'll be talking about laser rejuvenation, but I'm actually going to focus in on specifics. And today's topic will be laser rejuvenation in regards to darker skin type or ethnic skin types. So patients of type 3, 4, 5, and 6 skin. So basically these include patients of Asian extractions, Mediterranean, Middle Eastern, and certainly African American. So there are certain parameters which we have to follow, and there's certain rules that we need to follow. And the reason being is that with ethnic skin type, we pigment very easily. So we can have what's known as post-inflammatory hyperpigmentation. And if you go too aggressively, you can actually worsen the condition. In other words, instead of treating your pigmentation, you can actually worsen the pigmentation. If you go super aggressive, you can get hypopigmentation. In other words, that area can go white. So we have to be very specific in the lasers we use, and I'll give you a guide as to how I approach ethnic skin types. So what lasers do we use? Stay tuned. Okay guys, so this is one of my favorite lasers. It's a love-hate relationship which I have with Fraxel. So it's a Fraxel 1927. I think that's my favorite wavelength. Fraxel itself comes in basically 4 different wavelengths. We can talk about clear and brilliant, which comes in the 1440 wavelength, the 1550, which is a Fraxel dual, 1927, which I personally believe is the safest for ethnic skin types, and the Fraxel repair, or the CO2, which I believe is super dangerous for ethnic skin. So do I like this? Yes, I do. Does it work? Yes, it does. But the parameters of this has got to be much lower compared to treating Caucasian skin types. So watch carefully and I'll show you the parameters and how this laser is used. Okay guys, so this is Fraxel laser using a 1927 wavelength. So the Fraxel laser can be used in all skin types, from all the way from skin type 1 all the way up to skin type 6. So this is skin type 5, skin type 6. With darker skin types, we're actually using 1/4 the energy together with less than half the amount of passes we use for lighter skin types. And you can see shortly why we do this, because we do not want dyspigmentation or skin color changes. You can see what happens after treatment and how long it takes for the skin to heal. Skin starts to peel off at day 4 to day 5, and it takes all the way up to day 6 before the skin completely heals. And it can take way up to 6 months before the skin is completely normal. So this is after 4 treatments of Fraxel laser. Do we get an improvement? Yes, we do. However, there is significant downtime even with the 1927. So you can see that this treatment of Fraxel laser does work. However, you will see in the upcoming minutes why I prefer other lasers for skin rejuvenation in ethnic skin types. Another laser I like using is a clear and brilliant, which is essentially a mini Fraxel. Doesn't mean that if a laser is low powered it's bad, because for example CNB or clear and brilliant is actually a Fraxel laser. So it's a mini Fraxel laser, which means it delivers 5 millijoules, a quarter of what a normal Fraxel laser can deliver. But the great thing with that is that is the ideal treatment for certain skin types, like my skin type or ethnic skin types, but also to treat certain conditions like melasma or pigmentation. Now, like I said, one of my favorite lasers, my favorite all-time lasers, is because of not the actual brand of Fraxel. Don't get me wrong, it's not that I'm against Fraxel, I love it. I've got 4 Fraxel, 6 Fraxel laser machines. Absolutely love them, but the magic lies not with the actual branding, it's with the wavelength of the laser, and the wavelength is a 1927. So this is called a Pamir, and what it does is that it delivers fractionated laser beams into the skin, and that allows us not only to treat pigmentation gently, but allows us to actually infuse, and that's what I like, because we can infuse things like ascorbic acid, vitamin C, or collagen building peptides, for example, like copper peptide serums, and even fading creams. So that's the beauty about these lasers, is that they are soft, gentle, but they actually do work for the purpose. So I'll show you how it's done, guys. Okay guys, so I'm using the Clear and Brilliant system here. That's Clear and Brilliant, which is basically a mini Fraxel. So there are two different wavelengths in this. We can use a Clear and Brilliant Premier, which is a 1927, or another wavelength, which is the 1440. This laser is excellent for treating all skin types, but especially good for treating Asian skin types or darker skin types. I also use this laser in the 1927 Premier setting to treat melasma, as this will enable us to deliver good stuff like vitamin C, copper peptides, and various serums into the skin. So the treatment itself is virtually painless because we use a super duper numbing cream 23/7, and it takes about 15 minutes to do, and patients usually require about anywhere between 3 to 6 treatments spaced about 2 weeks apart. So a really gentle, no downtime treatment for all skin types. That's it, you're Clear and Brilliant. What are the before and afters like? Let's study Grace. So look, this is where she is from day one. You can see she's got dull skin, pigmentation, laxity. This is what she looks like at day 3. No flaking of skin. She's actually getting a change right now, and then this is what she looks like at day 7. Now let's have a look at her more closely and examine things between day 1 and day 7. Look how much more luminosity her skin has. It's less dull, but look at where the X is. You can see that skin tightening due to collagen contraction. The next laser we'll talk about are no downtime fractional picosecond lasers. Basis behind treating pigmentation and skin rejuvenation in ethnic skin types, I believe, now has taken a step forward with the invention of newer devices such as this, which is basically a Picosecond Q-switch laser. So this is the older version. It's called a nanosecond laser, and this is a picosecond. So picosecond lasers like Picosure, Pico, these all, I guess, are in the forefront, I guess, of treating ethnic skin types, and I'll show you why very shortly. In my opinion, the reason why I believe these fractional lasers are at the pinnacle of skin rejuvenation is that it is the only laser in the world that can actually give skin rejuvenation and pigment reduction with virtually no downtime. So there's no flaking of skin, peeling of skin. You basically heal up within 12 hours, and there is no other laser system on earth that can deliver that. However, it is biased towards ethnic skin types. I've treated my dad with this laser. I've had this treatment myself, and you will see shortly what I mean by a no downtime laser. So this laser itself targets the melanin or targets the pigment, but it also causes a pressure wave effect, which actually stimulates collagen, and hence why it is so good. The laser itself, look, the treatment itself is not painful. Once you have some local numbing gel, it's all over and done with within 10 minutes. And like I said, you're slightly red for at the most 6 to 12 hours, but you can resume your daily activities straight after. This is why I believe that picosecond laser technology is the pinnacle and absolute forefront of skin rejuvenation in ethnic skin types. So shortly you can see what I look like 12 hours after the laser. There's no areas of inflammation. I can just perceivably see a tiny bit of redness on my right side. That's the side which is more heavily treated. Driving side, so you get more pickup of the pigment. But otherwise, there's no swelling, there's no pain, and I can carry on doing my normal activities. In fact, I'm going for a run right now. So I really do believe that this is the world's first no downtime laser that actually works and delivers what it's supposed to, especially in ethnic skin types. So what are the before and afters like? So this is me, this is myself after one treatment only. Look at the marked reduction in wrinkles as well as pore sizing with just one treatment. This is another example of pigmentation together with skin laxity. And this is after 3 treatments. Look at the marked improvement in both luminosity of the skin together with the marked decrease in wrinkling. So look at it side by side. The skin is totally transformed, absolutely transformed. And once again, this is done with no downtime whatsoever. Hard to treat because this is actually skin type 4. Look at the pigmentation there and there, and that's after only 1 treatment. So it gives a pore reduction together with a reduction in pigmentation, and that can be achieved with no downtime. What we have here is an Indonesian gentleman. You can see he's got marked wrinkling. This is after 2 treatments only. So 2 treatments only and with a marked reduction in wrinkling. This is my dad. You can see he's got skin laxity together with areas of pigmentation. And this is after 2 treatments and 2 treatments only, before and after. That's a marked improvement with all aspects. If you don't have access to a Picosecond laser, you can use what's known as the old-fashioned dermal toning. So basically this is using nanosecond technology. The advantage of this is that it's much cheaper compared to Picosecond lasers. However, the amount of collagen remodeling is not as good compared to the Picosecond. Additionally, it takes a lot longer. Basically, you may take anywhere up to 10 treatments, and then treatments are spaced every 2 to 3 weeks apart. So do we still use nanosecond? Yes, we do. However, in my opinion, Picosecond laser technology gives you much better results with much less treatments. So there you have it, guys. That is Q-switch laser technology for you. Okay, so what about fractional laser resurfacing using CO2 and erbium? CO2 laser resurfacing is great for acne scar types. So this provides the best for collagen regeneration as well as scar remodeling. That's a CO2 laser. The downside about it is that it has a longer downtime. So what do I use instead for rejuvenation? An erbium laser. An erbium fractional laser is safer for rejuvenation. The good thing about it is that it has a faster healing up time with less chances of post-inflammatory hyperpigmentation. So this still can be used for scarring. However, the CO2 laser is still, in my opinion, better for scar types. So when it comes to rejuvenation, what are the before and afters? This is a typical case. Before and after 2 sessions of erbium laser resurfacing, this is what we get after. And this is a lady of Middle Eastern extraction. Before and after 2 sessions of erbium laser, this is what we have. Much less wrinkling. So guys, thanks very much for that. Thanks very much for watching that video on skin rejuvenation in ethnic skin types. Just remember, if you are of darker skin race, try to see a specialist who actually knows how to treat darker skin types. And remember, it's not one device. We've got to have multiple devices because they can actually tier that particular laser to your skin type. So today I've only dealt with lasers. There's a whole gamut of other devices out there, including things like microneedling, PRP, radio frequency. We can talk about thermage therapy. If I did that, this video would go on for another half an hour. So I'm trying to keep it short, concise, and I'll broach all those topics in the upcoming months. So once again, thanks so much for watching. Subscribe if you'd like to learn more. One new video every week, and I'll see you next week. Thanks for that, guys. Bye.